I think most hospitals now are beginning to take a hard look at antimicrobial stewardship. The recognition that there are now infections in the hospital that we no longer can easily and effectively treat with a broad armamentarium of antibiotics. As the germs have gotten smarter, we now have had to say, how are we going to roll that back? How are we going to stop that? And so antimicrobial stewardship is a critical component of that. How do we guide usage toward the correct antibiotic and begin to get our hands around this problem? Really, the most important thing in terms of getting a first start on this problem is to put the correct team in place and the correct resources in place. And we think that means putting an infectious disease specialist in a captaining role of a team that consists of infection preventionists, pharmacists, microbiologists, in a multidisciplinary approach to attack the problem. And that sounds like a lot of resources, but in the long run, as you reduce healthcare associated infections, as you reduce length of stay, as you reduce antimicrobial costs associated with these problems, it's a bargain. This is a very exciting study for us. We did a big data study, 35% of the CMS claims database, looking at 11 key infections, comparing cases where infectious disease specialists were involved versus cases where they were not. And in the cases where infectious disease specialists were involved, when they were involved early in the first 2 days of the hospitalization versus when they came on the case later. And what we found was when infectious disease specialists were involved in the care of these infections, there was savings in terms of mortality, length of stay, and readmissions. And when infectious diseases specialists were involved early, we saw an intensification of those effects, and in addition, we saw decreased cost in the hospital.